The preferred route of administration of streptokinase in acute myocardial infarction is intravenous, subcutaneous, intracoronary, or intracardial. Number one, intravenous. Next, the primary mechanism of antibacterial action of the penicillins involves inhibition of beta-lactamases, cell membrane synthesis, and N-acetylmuramic acid synthesis, peptidoglycan cross-linking. Correct answer is D, peptidoglycan cross-linking. अब इसकी स्टेटमेंट पढ़ लेते हैं. पेनिसिलिन्स एंड सेफेलोस्पोरिन्स bind to BBPs acting at the transpeptidation stage of cell membrane synthesis, the final step to inhibit peptidoglycan cross-linking. The beta-lactam antibiotics also activate autolysins, which break down the bacterial cell wall synthesis of N-acetylmuramic acid. Inhibition by phosphomycin. Vancomycin inhibits transglycosylase, preventing elongation of peptidoglycan chains. Next, the following drug given concurrently can enhance toxicity of digoxin. Number one, phenobarbital, metoclopramide, quinidine, or magnesium hydroxide. Number C, quinidine. Next, referring to the following figure regarding the pharmacokinetic of prototype drug X100A, a novel chemotherapeutic agent to treat breast cancer. Which of the following letters represents the process of elimination? Number one, letter A. Number two, letter B. Number three, letter C. Number D, letter D. Statement पढ़ लेते हैं. Correct answer is D. Elimination is represented by the letter. The drug and its metabolites are eliminated from the body in urine, bile, or feces. Letter A represents the process of drug absorption from the site of administration. Letter B represents the process of drug distribution ultimately to the into the interstitial and intracellular fluids. Letter C represents the metabolism of the drug in the liver or other tissues. Next question. The anti-arrhythmic drug which decreases both rate of depolarization phase 0 as well as rate of repolarization phase 3 of myocardial fiber is lignocaine or propranolol, quinidine, verapamil. Number C, quinidine. Anti-emetic action of piperazine is due to interference with ATP generation in the worm, blockade of glucose uptake by the worm, hyperpolarization of nematode muscles by GABA, agonistic action, depolarization of nematode muscle by activation nicotinic receptors. Correct answer is C, hyperpolarization of nematode muscles by GABA agonistic action. Next question is that the adult client recently has been diagnosed with asthma. Which medication is recommended to treat this problem? Number A, omeprazole daily, or number B, amoxicillin twice daily. Number C, loratadine daily, prednisolone daily. Correct answer is A, omeprazole is a protein pump inhibitor. Up to 90% of the adult onset asthma is the result of GERD. Treating the gastric reflux will treat the asthma. Amoxicillin is a penicillin-derived antibiotic. The client is diagnosed with asthma, not an infection. There is no reason to administer an antibiotic. Loratadine is an antihistamine. Antihistamines such as Claritin are used to treat allergic reactions to pollens, dust, or other irritating substances. They are not effective. Glucocorticoids are prescribed daily for clients with chronic lung disease such as emphysema or chronic bronchitis. A client with asthma would not be prescribed daily steroids. Next question is, the potency of inhaled anesthetic is defined as the minimum alveolar concentration. 5 anesthetic gases are infused into 2 kg rates denoted as gas through gas E with the max noted. Which of the following gases would likely be nitrous oxide? Gas A, max 0.75%. Number B, gas B, max 1.2%, and gas C, max 2%, and gas D, gas E, max 10.5%. नंबर डी. अच्छा, अब इसकी स्टेटमेंट आप खुद देख लीजिए.